Hi guys, we're here for another couch talk here at FAM, and this month we are going to talk about colorectal cancer because March is National Colorectal Cancer Awareness Month. So Autumn, tell me what you know about colorectal cancer.
I know that colorectal cancer is one of the most preventable and treatable cancers out there if caught early. And so because of that, we usually talk about screenings, the age that we do screenings, and also just symptoms to look out for too.
Yeah. And you know, statistics say that it's the third most common cancer, which is why we screen for it. Because there are some cancers that are not as common, so there's no like national screening guideline. But something like colon cancer, everyone should get screened. And so what age, because I know the recommendations have changed, right? What age should we start screening for colorectal cancer?
So for just about everybody, we've actually moved down the age from 50 to 45. However, it varies by person because, for example, if I had a family history where I had a mom or a dad or a sibling who was diagnosed, they might start my colonoscopies at a younger age because I'm at a higher risk, so they want to catch me early. Versus if there's a great-grandfather with colon cancer, your screening is actually just the same as everybody else. Because it's kind of so far removed that it doesn't necessarily worsen your risk factors. And then the frequency of the screening depends on what kind of screening you do.
And what the findings have been with your initial screening, right? So everybody should start at least at 45, and then unless your doctor tells you to start sooner based on your risk factors or family history. Okay, and then so is this just a screening for men, or who gets colorectal cancer screening?
Everybody does, because everybody does have a colon. It gets kind of conflated, I would say, with the prostate cancer screening because the prostate is if you will, kind of in the same area as the colon. However, the colon is the end part of your digestion tract. So everybody has a digestion tract because everybody has to eat, and so everybody has to be screened for colon cancers.
For colon cancer. So there are various ways to screen, but one way is what we call the gold standard, right? And the reason we call it the gold standard is because it's the one that's been proven to work the best. So what ways are there where people can get screened for colon cancer?
So that gold standard that you were just talking about would be a colonoscopy. And so that is where they take this little tiny camera and they stick it all the way throughout your gut and throughout your intestines to try and see if they can find any polyps, any precancer, anything like that. So the cool thing about a colonoscopy is what we call both diagnostic and both screening. And so I always recommend colonoscopies because I feel like it would give me such reassurance too. Because if they find any like polyp or anything that they're not sure quite what is going on, they're going to be able most times to just take it out that same day. So God forbid if it comes back and it's like pre-cancer, well, at least I can sleep at night knowing that is no longer inside my body.
Right.
And so it can both treat and it can also both screen. So that is why and I'm pretty sure just about every provider out there is going to talk to you specifically about colonoscopies.
And there are other things that are out there for those who maybe the cost of the colonoscopy is just too much for them to afford, or for those who say, well, I really don't want to go through a procedure. And keep in mind that during a colonoscopy, people do not report pain, right? Because they give you medicine. It makes you just go to sleep during a procedure. It may last about 30 minutes and then you're done. And if it's normal, you don't have to get that procedure again for 10 years, right? So that's why we really like it, because it's something that can be done. It's something that can remove anything that can turn into cancer in the future. And it tells you how frequently you should come back. But should a person not be able to get a colonoscopy for whatever reason, is there any other tests that are out there that they can use for colon cancer screening?
There absolutely is. And the one that we talk about most, especially here at Family Medicine, would be a Cologuard testing kit. And so that is a kit. It's actually really, really convenient. But just because colonoscopies are the gold standard, we always talk about them. But for my patients who are like, absolutely not, I usually go towards the Cologuard screening. They'll send you a kit to your home, and you basically just mail back the kit, which is just a stool sample. They'll look at it underneath microscope, see if they can find any abnormal cells, blood, things that would make us suspicious for colon cancer. And at that point, if it is positive, you are going to get a colonoscopy so that we can know exactly what we are working with.
So if it's abnormal, you get a colonoscopy anyway, right? Okay, so the cool thing about that test, though, is it can pick up on DNA, right? That is like specific for colon cancer. So if it is positive, it's saying there is something abnormal, we are picking up something, and you may actually have colon cancer at that point. However, if it's negative, then that means that, hey, I've been checked and I know at this time I do not have colon cancer. But instead of every 10 years, you're going to have to go back every 3 years. Right? So it's more frequent, even though it doesn't take up as much of your time. You can do it in the privacy of your home. You just poop, you send a sample, and then they do the testing on that stool sample. However, with a colonoscopy, there is some prepping before, right? So we do have to refer you to a specialist, and that specialist is called a gastroenterologist. They deal with your intestines and your gut tract, so to speak, and then they will evaluate you and they will schedule you for that procedure. They are the ones that do that procedure. Or sometimes, if you live in a small town, the general surgeon or even some family doctors are ones that do it as well. Usually you'll find that in smaller towns where that doctor is the doc for everybody, right? And so if you are unable to do that, then the Cologuard is another option. There's also the option of the occult blood test, right? And so that is literally where we check for blood in your stool. Now, the problem with that one is that blood can come from various things, not just colon cancer, but something as simple as hemorrhoids can cause like bleeding in your stools. So if that test for the blood is positive, you still have to get additional testing, which probably will still be a colonoscopy. If it's negative, then instead of every 3 years, you literally have to do that one every year, right? So sometimes even if you say, I want the easiest option, which is like just check for blood in my stool, you still have to do it more frequently. So once a year, whereas the Cologuard for the DNA is every 3 years, and then a colonoscopy, if it's normal, is every 10, right? And so people just have to think about that. So convenience is one thing, but timing, how often I have to get it, and then cost as well. And most insurances do cover your colonoscopy because it's considered preventative. So your doctor will do the referral for you to that specialist once you hit either the age range or your risk factors say so. So when you think about colon cancer, is it that like, should I just be worried if it runs in my family, or if it doesn't run in my family, am I pretty good and I can like pass it and push it back and not necessarily have to follow up?
I guess in my mind, everybody should be checked because everybody has the chance of having colon cancer. It is a greater risk if you do have that family history, but it's not like you don't have a risk without the family history. It's there no matter what. Kind of like breast cancer. We check everybody. We check you more often, or we start checking you at a younger age if you have a family history, but realistically, everyone should be checked. Same for the prostate, same for the colon. Especially whenever we have these tests that we can specifically check. Like you said, it's the third most common cancer, and so it's common for a reason, unfortunately. And so definitely everybody should get some sort of evaluation or some sort of check.
Is there like any like signs that someone like could look out for, symptoms early on?
Yeah, and then I was also going to add that even though family history is important, when you actually look at the statistics of people with colon cancer, the highest number of people with colon cancer are ones that it did not actually run in their family. So just because you don't have a family history doesn't mean you're in the clear, right? And then people always ask about, well, what should I be looking out for in my own symptoms, right? So what kind of symptoms would you say that if you see this, you should definitely bring this up with your doctor or your provider so that they can talk to you about if you need to be tested for colon cancer?
There's a handful of things, but really I would think about chronic constipation. Sometimes if we have some polyps, sometimes if they're really big, then it can kind of obstruct or like narrow down your colon so that there's only so much room that stool can pass through. So chronic constipation can be one, but honestly, it should just be checked anyway. Another one is blood in stool. And so if you have blood in your stool, that's not normal. So whether it's something very common like hemorrhoids or anything like that, that should be checked no matter what, because we just need to know why, and we also need to know how bad and if we need to fix it. You could also have left lower quadrant pain, which basically just means pain in this left lower area right above your hip. The pain here, sometimes it's worse with eating, sometimes it's just pain in general, but usually if you have pain somewhere, it should probably be evaluated anyway, even if it's just for us to say, okay, nothing abnormal or there's nothing bad going on, we should just get you checked out just to make sure that it's nothing bad. But those are the ones that I usually give my patients. We talk about colonoscopies every year at their annual screenings. Those are the ones that I give them to look out for, which is blood in their stool, pain right here around this area in the abdomen, and also constipation.
Yeah, and things that I would add too is like a change in the caliber of your stool, which basically means it might start out like nice and round, it might change to pencil thin, and then it might like spread out, because literally if there's a mass, if it's trying to move past that mass or that part of cancer and it's squishing it, it can change it. Yeah, so it may look different than it has looked in the past. And then the other thing that's really alarming for providers, you may actually not have a symptom, but when we check your labs, especially in a man, there's no reason for a man to be anemic. So if we find anemia in a man, then we start saying, where is that blood being lost? And the light bulb goes off in most providers' heads that says, if this man is anemic, I need to screen him for colon cancer, because where is this blood? Where is he losing blood? And the more common place is in the gut, in the stool. So definitely, if your doctor does your annual and they find anemia, they're going to try to figure out where it's coming from. And unfortunately, anemia is another thing that we may find on your exam. They may tell us, hey, we need to check you for colon cancer. So you may not be symptomatic from that standpoint, but it is part of the medical history that definitely should be evaluated.
I remember they told us in school a few years ago that if you have an anemia, it is a GI bleed or a GI origin until proven otherwise. But that's just because those can be very severe things. In women, we have other reasons. Check every time, but we're still like, how bad are your cycles? But for men especially, it is GI related until proven otherwise.
So there are some things that people can do, though, that either increases their risk for colon cancer or can actually decrease their risk for colon cancer. So let's talk about things that can increase your risk for colon cancer. So what would you say some of those things are?
Obesity depends on your diet too. If you're eating a lot of like red meat, that can increase your risk for colon cancer.
The processed meats, like the deli meats that you're getting.
Super salty ones, What would you say for yours?
So I would add smoking to that, right? Like a smoking history. So if you're a cigarette smoker or you indulge in your cigars or whatnot, then that can potentially increase your risk as well. And a low fiber diet, right? Because if the bowels aren't moving and being flushed, that actually increases your risk for colon cancer too. So now that we talked about the bad stuff, what are things that somebody can do to actually decrease their risk for colon cancer?
So I would definitely, once again, go in with a diet. And so eating fresher foods, and by that I mean like more vegetables, but specifically if you can get the vegetables that aren't canned, so the ones that are just like the produce section, that's definitely going to help. And it also usually has a decent amount of fiber in it, which will help with the bowel movements as well. Make sure that you're not like constipated or, like you said, it flushes it all out. I would exercise. Exercise doesn't necessarily directly, it's not in the terms of like, if I lose 10 pounds, I'm not going to be at risk for colon cancer. No. But obesity itself is a risk factor. Exercising improves obesity, and so that would be it. But exercising just fixes everything almost.
Yeah. So diet and exercise is really important, and then not putting things that could potentially cause cancer in your body. So if you do smoke, stop smoking, right? So that can definitely help, and trying not to eat those red meats and processed meats is also going to be really important too. Okay, so I think that that's really helpful for people in a sense of just kind of hitting on what you should be aware of, when you should start getting tested. And then again, if you have any questions, or if, hey, you're 45 or over and you haven't had a colonoscopy, please reach out to us. We can definitely help get you scheduled and discuss those screening options with you. Or if you don't live here in Houston, reach out to your provider and have that discussion with them. Learn your family history. That's really important, because you definitely want to know if something affected the people in your family. How soon should I get tested for these things? And then definitely give us a call if you need our help. So until next time, everybody.
Bye, guys.